I'm very concerned about the significant premium increases that we've been discussing, especially the ones that are going to be going up in 2017 on the Illinois Health Insurance Exchange. Of course, the ACA's premium tax credits will shield the vast majority of the 335,000 Illinois residents who shop for insurance on the Illinois Exchange from significant increases in premium rates. But as the Chicago Tribune reported recently, even if the premiums increased by 50%, the ACA's premium tax credits would ensure that nearly 2/3 of Illinois enrollees could still enroll in plans that cost them $100 or less per month. I am concerned, however, about the impact of this increase on the 84,000 Illinois residents who don't qualify for tax credits, and I'd like to know what steps we can take to empower these consumers to be smart shoppers in the exchange, and what reforms are needed to ensure regulators effectively protect these people from unreasonable rate hikes. With that, Dr. Cohen, I'd like to address this idea of filing healthcare rate increases. I understand that all states are required to file healthcare rate increases of 10% or greater with CMS. Each state determines whether or not to reject or modify these rates, even though they have to file them with the CMS. So am I correct in understanding that the state review programs are not created equal? Some regulators are weak and some are strong?
I think that'd be correct. And there are a number of states in which we, CMS, do that process, but in the majority of states, the Department of Insurance does do that process, but I agree with you that variable in terms of the authorities that they have.
Okay. So while some states are empowered to provide relief from the skyrocketing rates to their citizens, others like Illinois, we don't have the enabled regulators to reject these astronomical rate increases. I'm hearing the term file and use for states like Illinois. So long as insurers properly file the rates with their regulators, they can use them. Is that correct? Can you explain that file and use term a little bit?
Yes, I think my colleague from the Department of Insurance can probably speak to this in addition, but yes, those are, depending on what state you're in, that there are different authorities, and Illinois has one where they can review them, but essentially can't change them. Okay.
Is it Mr. Redmeyer, do you have a comment on that?
I will not speak to Illinois. I can tell you that Maryland is not file and use when it comes to health insurance, but other parts of the insurance market are file and use, but just because it's file and use does not mean that we lose our regulatory authority over those rates in Maryland.
Okay. Back to you, Dr. Cohen. Can you tell me, do we need to change policies for regulators in Illinois and other states so they can do more to stop these rate increases that make the care unaffordable, or what could be potentially be done?
Well, if you look across the country, and I think, Congresswoman, this is what you're seeing in states that do have the ability to do rate review. You are seeing folks look at those rates and make changes to them. I think what we've been talking about for this year is that there are some one-time upward pressures on those rates, but we have been working very closely with the state departments of insurance, and when they are working closely with their insurers to make sure that those rates are appropriate.
So is this a state-by-state issue, or is this anything that can be done at the federal level?
That's correct, state by state.
State by state. Is there any type of coincidence or matching with the states that are more file and use and have less enabled regulators versus the states who, for example, have refused Medicare expansion?
So we have seen that in Medicaid expansion states that the private market, the marketplace has seen premium increases that are about 7% less. So we definitely are seeing where Medicaid expansion is having an impact on marketplace premiums. And I could get back to you where I don't have it at my fingertips, but I know that there are studies that have shown where states are effective rate reviewers, that there is more engagement on the rate process. They do these open public hearings, and they are able to do some additional work on understanding and justifying those rates.
Mr. Redmeyer, do you have the public hearings in Maryland? How does that work?
I discussed this earlier. In Maryland, we have the rates, proposed rates are given to us May 1st. We receive all the actuarial documentation and data. We have a team of actuaries that scrub the data. They challenge the projections and the experience. In Maryland this year, we had 2 public hearings. and then we ultimately approved rates that in aggregate were about $24.5 million less than was originally requested. But you bring up a great point, and that is as is always the case, the vast majority of the middle class that does not have access to Medicaid, they don't have access to subsidies, and they really are being hurt by these rates. And my concern is that it is the business death spiral. In other words, as the rates increase and folks have to pay 100 cents on the dollar of these increases without a subsidy, it's going to be the folks that are healthier and younger that are going to choose to leave the market, pay the penalty, and the experience will deteriorate further.
Thank you. I'm out of time. Thank you, Mr. Chairman.